Scott Sloan on 700 WLW. All signs, all indications are we're going to get slammed with higher health costs coming up as we find out our benefits and enrollment plans in the next month or so, right? Because this is the time of season where we start to pick our plans, and you in, you out, you kick the tires on things, and you try to find the plan that's right for you and your family. But the bottom line is, no matter what you choose, it's probably going to be more expensive this year than ever before. So we also have employers trying to make that decision. Do they take the hit or pass the added costs on to employees? And the higher that number is, the more likely it is that they're at the very least going to split it with you. At the worst, they're going to dump it all on your shoulders, and you're going to see more coming out of your paycheck. Paul Seegert is here. He is with PCS Healthcare Advisors. They advise small businesses, medium and large, on trying to keep their health care costs under control. And Paul, we haven't had this conversation in a while. I mean, it seems like, at least from my user perspective, our costs have remained relatively flat. But why all of a sudden are things about to spike? And if so, how much?
Well, we've got a situation where it lags. Healthcare inflation lags behind the rest of the market because you'll have multi-year agreements. So you'll have a hospital system that will get in agreement with an insurer that, let's say, lasts 2 years. So they have their reimbursement rates set. Mm-hmm. And then you have everything that's happened in inflation in our economy in recent months and, the last year or two. And we're at a point now where, despite how wacky this whole payment model is and business is, 53% of hospitals are actually expected to lose money this year because of how much their labor costs have gone up and all their other expenses. So that will finally, with some delay, it's finally going to impact employer plans and translate into higher premiums.
Say that again. More than half of hospitals in America are going to lose money this year?
Yeah, they did great during COVID. So, don't get out the tissues and start crying necessarily. But it is a serious issue. They're going to lose money because we've watched for example, the cost of a traveling nurse went from $1,900 to $3,500 a week with $20,000 or $25,000 signing bonuses. And there's many things like that have occurred. Their cost of goods have increased. All the materials it takes to run their facilities have increased, and their reimbursement rates from insurers have not. So insurers have really, they locked in a lot of these multi-year agreements right as we were heading into a lot of this.
Damn. I've heard that a lot with traveling nurses, and it's a huge thing, right? When my mom was sick, there was a traveling nurse that was great care, and she said, I actually have an RV. I drive it from city to city, and I move from place to place all the time. I get to meet new people and see different things and experience, but make really, really good money. And $3,500 a week is really, really good money. Why the move towards traveling nurses as opposed to just having nurses that work in the same hospital?
Well, there's a staffing shortage, and that existed before the pandemic. Right. It got worse through the pandemic. So we're short. We're not talking a little bit short. I mean, the healthcare industry is short 500,000 plus people. And so now the employees are in a position of real power. Right. So what we watched was some of these nurses, as an example, they would leave. Maybe they had a job at a rural hospital, which had been the hardest hit in this whole process, but they'd have a job there. They'd quit because they're getting so many offers. Right. So they're sitting here making $60,000 a year, but then they could convert that over to $3,500 and get enough money to, $25,000 to buy a new car or something.
Yeah, or RV, right? And so all that money goes in your pocket. I think that's brilliant. You're doubling your salary pretty much there too. I'm glad, Paul Seegert, too, you mentioned rural hospitals, because if 53% of hospitals are losing money, I suspect a lot of those in rural areas, and I suspect that a lot of those hospitals are going to close, and we've seen that already.
Yeah, that trend is unfortunately been around for quite some time, and it will likely continue. So then it won't shock me at all if we see more consolidation come out of this, where larger hospital systems go in and rescue, I'm putting that in quotations, rescue some of these smaller facilities. The bad news there is it continues this whole snowballing trend of decreasing coverage and increasing costs, because whenever we go back into a market where that has happened, big player came in and bought up little players, costs of healthcare go up. Usually a year later, they're 7, 8, 9% higher.
Right. So is that the projection for what we're going to see? Up to 9% increase in costs? Or are we going to see more?
Actually,
What's that?
10 is what we're seeing across 72 markets. The average is about 10%.
Okay.
Now, there are some where it's higher, and it also depends what size of employer we're talking about, or are we talking about individuals going to the exchange? A lot of those folks are going to be insulated from this, the individuals going to the exchange, because we expanded subsidies during COVID, and we extended them as part of the Inflation Reduction Act. So there's not the same. So we have that same situation continuing where really nobody will pay more than 8.5% of their income if they go to the exchange to get a plan.
Right.
So even though these premiums are going up to double digits, most of the people that get coverage through the exchange won't feel that. So they'll be insulated from it. It's just going to be paid for by the taxpayer.
Is this going to push more people to? Is this going to push more people to the exchange then, to Obamacare?
That trend, I think, will also continue and pick up pace. We've been watching employer plans enrollment overall on a real macro level in employer plans has been slowly declining, while those who are going to get subsidized coverage or access it through the exchange has been slowly increasing. Mm-hmm. So we have seen a shift, because there are small employers that get to a point that said, I was talking to one yesterday, a mid-sized employer that said it's at a point for them where last year they considered just turning off benefits altogether and telling their folks to go to the exchange and get it, because if they don't offer benefits, then their people can qualify for some subsidy. And there's a lot out there.
Right. And that makes sense, too. When you decide to do this, you look, hey, my costs are going to go up 10%. And I'm going to guess there's going to be a lot of people who are working now, get their health insurance through work, Paul Seegert, that are going to shop, right, and go, hey, do I want to keep this, or should I start moving towards the healthcare exchange? And then adding up the costs and everything. But I think the great unknown is, I think people are scared of it, too, because I've heard, Medicare, Medicaid stories where, it's hard to find a provider. But with Obamacare, I mean, it seems like most people who have it like it, right? Or am I wrong about that?
It's become more and more popular over time. That's accurate.
And as far as the coverage goes, people are thinking, well, it's going to be inferior coverage. I'm going to get the worst doctors and healthcare providers if I get on the government insurance as opposed to private employers. But largely, it's the same, isn't it?
Well, I think it could be largely the same for the consumer. Mm-hmm. The reimbursement rates to the providers can be different.
Right.
If you show up at a hospital today with Medicare or Medicaid, that hospital oftentimes loses money on that transaction. They might need 120 to 140% of what they collect. Mm-hmm. They're willing to do that because they're going to turn around and make their profit margin on employer plans that show up, private payers. So to me, if we step back again and just do a big macro look, we're setting up a really bad situation for the overall system, since we don't treat all payers equally. We've got employers that are really subsidizing the government payers. We've got providers that lose money on government payers, and that pool is growing. And the folks they make money on, these employer plans, is shrinking, which means those employer plans, the increased cost that's getting shifted to them each year is going to have to accelerate to keep this whole thing afloat. And a lot of Americans don't realize you can't do a single payer at the same level of quality that we see today, because some payers, the government payers, particularly in this case, are not paying their fair share in terms of the overall cost of care.
Gotcha. If more people go to the exchange, is this just like a roundabout way to get rid of private healthcare insurance?
Well, the trend is that the private, payers are on the decline. Mm-hmm. I think we're a lot closer to a boiling point than people might realize, and that because of what I was talking about earlier, private payers keep the whole system afloat at the level of quality we have today.
Right on.
So we have to address that, and either reimbursement rates. If it goes much more in this direction, then the government reimbursement rates have to go up, or we're going to put employers in a position where you have to be a massive employer to afford health care for your employees.
Well, we're in a place now where the minority of us pay the majority of taxes. So why would health care be any different?
No, that seems to be the direction we're heading.
Yeah, it does. All right, so be prepared as you're ready for your fall benefits meeting. If you feel that sensation of your chest tightening, that's just the screws from the man coming down on you. It's going to take more money out of your wallet. So, Paul Seegert from PCS Healthcare Advisors, national firm. Thanks again for depressing us. I appreciate it.
Happy happy to help.
I'd love to get Paul on sometime when he's not giving us bad information or sad information. I guess I should say he's got good information, but tends to depress you, right?